И я представляю вам нашего следующего спикера. Это Лотта Сylwander, глава офиса UNICEF в Украине. И, собственно говоря, мой босс, моя начальница. И я ее буду интервьюировать, что будет само по себе интересным достаточно экспериментом, на мой взгляд. So Lotta, hello. Thank you so much that you agreed to participate in this interview.
Thank you.
And my first question would be the following. What did you learn as a person and as a head of UNICEF through COVID?
Oh my God. I think a lot of things. I think the first thing that I've learned is how easy it is to upturn all our lives, and that one thing can change everything, the premises, the assumptions and so on that we have about how we live, how we go about everyday life. The second thing is, I think, how difficult it is to change behaviors and to make people, even colleagues sometimes, understand how a virus like this works and why it is so dangerous and why we need to be extremely careful and we need to change the way that we interact with people, the way that we touch things, etc., etc. And maybe lastly, how confused the medical sector, if you can call it that, is about how you treat COVID, what to give patients, what not to give patients, etc., etc. And the amount of sort of false facts about the virus, the treatment, the behavior, how it spread, etc., etc. All of those things, I think, have been the surprises, but also the learning curve that I've had to go through.
And the coronavirus is with us for quite some time. When was the first time that you personally, got scared and decided to change your behavior?
So I heard about it quite early. I mean, the sort of seriousness. I think, like most people, I said, oh, but it's just a flu, you know. But it isn't just a flu. But I've lived in Vietnam, and I have friends there. And in February, Vietnam closed its borders. So 3 or 4 weeks before Europe and Ukraine and so on did that. And that's when I started to realize that this is not just a flu, this is much more powerful, because they're neighbors to China. They knew something that we hadn't realized yet. And so that was there in my mind. And then I actually went home to Sweden in March. I still had the little bit of like, it's just a flu. But I realized that people around me were actually getting sick. Family members who lost their taste and smell ability didn't get really sick. But then I had an old relative, 89 years old, who was already in an old-aged home with severe lung issues. And she got COVID. Luckily, she survived, but that's when I realized how dangerous it is and how quickly a life can change and be gone.
And what was the first habit you took as a strong new habit?
Washing my hands, washing my hands, washing my hands.
And speaking about all the behavior change and people's nihilism still to the virus or to the danger,
yeah.
What do you think about such an unpopular but very important topic as lockdown?
I think that restrictions are necessary. I think that because, and now I'm talking about Ukraine in particular, there's a lot of disbelief, or even I don't give a shit, excuse the expression, but I don't give a shit about what's happening. I'm going to behave like I did before. I'm going to continue to be close to people. I'm going to continue shaking hands. I'm not going to wear a face mask. All of those things, it's still out there. And there's big events still out there. Parties, all kinds of other events where lots of people go. There needs to be restrictions. And people need to adhere to those restrictions. And if they're not, they need to somehow be punished, or they need to be fined. So the restrictions need to be enforced, and there need to be legal action. You know, police need to be able to interfere, and so on. If you say, like last weekend, I mean, we had a lockdown here in Kiev, and still there were restaurants open, although all restaurants were supposed to be closed. But nothing happened. And I wonder what a kind of super spreader event actually took place in those restaurants, because of course people would flock to those restaurants. So restrictions need to be there now and not in 4 weeks' time. They need to be there now.
Why now?
Because we have so many new infections in the country. There is the expression, the incremental rise of infections. It means it's not a slow rise, it's like this now. And that curve needs to be broken. Why? Well, of course, to stop the infections, but also because the health system is on its knees. I know that we hear that, no, there's enough COVID beds in hospitals for patients. Yeah, maybe there are beds, but there's no oxygen, and there's not enough doctors, there's not enough nurses to care for those patients who might occupy the beds. But primarily, there's no oxygen to give to those patients that come in. And therefore, the health system is on its knees and need a break. They need infections to plane out a little bit at least, so that they can handle the cases they have and not have constantly new cases, more cases coming in all the time.
What did you learn during COVID as our boss, as the manager of the UNICEF of Ukraine?
I learned that it's possible for us to rally around one issue, and that, so we work in so many different areas. We work in education, we work on you know, protecting children from abuse and exploitation. We work on laws and legislation pertaining to children. We work on water and sanitation. And at first glance you say, what does education have to do with COVID? Well, it has everything to do with COVID, because children go to school, and they didn't during the first 6 months of the COVID epidemic or pandemic. Nowhere in the world. So basically, a lot of children lost half a year or maybe even a year of schooling, especially those who are poorer and can't access education through you know, using a laptop and computer. They don't have Wi-Fi, etc. So that was one thing. Working, for example, on child protection issues. Because of COVID, 42,000 children were sent home from institutions, from orphanages, from other institutions. And they were sent home to homes that couldn't really care for them. Homes that were poor, homes that had drug abuse or alcohol abuse problems, etc., etc. You know, the sort of social worker system not being prepared for caring for those children, being able to follow up and monitoring how they were doing at home. And also social workers not having any kind of medical training, not being given any protective clothing or any sort of training on how to behave when they go into a home to monitor those children. So we discovered, I think, that a pandemic like this affects every single area of a child's life, of grown-ups' lives too, but the children seem to affect children much more than it affects grown-ups. Not because they become sick. Generally they don't. 11% of those who are, you know, sick or get infected with COVID are children. But they are affected in the sense that, you know, the family gets poorer, they don't get any protection, they don't get any education, their life is interrupted. Mm-hmm. And a child is very dependent on having a normalcy, a rhythm to life. I go to school, I come home, I eat, I play. A routine. And that routine has been severely disrupted. And there's not clear, like, this is when I study, this is when I play, this is when I do, and spending a lot of time at home with a family who might be stressed, who might have someone who's sick, who might lose their income. That's a very stressful environment for a child.
Do we need to speak to children about COVID?
Yes, we do.
And what would you say? What did you say to your grandchildren?
Yeah, so my grandchildren very quickly learned how to wash hands and you know, sing a song and wash their hands and do all that. So that was the easy bit. The more difficult bit was not touching things when they go out. How do you play in the park without touching things, for example? But for them, it's a very abstract thing, a virus. You can't see it, you can't touch it. And for smaller children, it's very difficult to understand an abstract thing like that. So you have to make it into a game, a play, something that's fun and something that they get rewarded for doing, like washing hands.
What's the most challenging for you as a boss, as our manager, about your staff, about us, basically?
I think the most difficult is to see that people like you who don't get burnout, you know, fall apart, because I know you're working day and night and you're giving so much of yourself, of your time, of your feelings and everything. And it's difficult to know how I can best support staff in managing this. That's, I think, the most difficult task for me.
Tell me, you worked in UNICEF actually for how many years?
15.
15, which is pretty long, and you witnessed a lot of efforts which are related to immunization. For example, measles immunization to eliminate measles, polio eradication, all different kind of. What's surprising for you in the current effort with COVAX, with COVID vaccine? What's different from all what you saw before with enormous global efforts in immunization?
So the first thing globally that's surprised me is that there seems to be a common understanding and a common agreement that COVAX, the vaccine, whichever vaccine it will be for against COVID, will be distributed equally or equitably, you know. So it's not like the rich countries are going to get it all, or those who can pay most will get it all. No, the price will be the same for everyone. Every country in the world will get, what, 20% of their total need from the first sort of production batch. That has surprised me. It's sort of commercial, capitalist mechanisms have all of a sudden been set aside for the best of humanity, and that's something amazing, I think.
That's very sweet.
Yes, yeah, it is. And then maybe the second thing is, how is it that scientists have been able to develop a vaccine so quickly for something like this, when I know, for example, that AIDS is still around and there's absolutely no cure whatsoever in sight, never mind the vaccine. So there seems to be an extreme effort that has surpassed any other medical efforts towards any other disease in the world right now when it comes to COVID.
You are from Sweden, correct?
Yes.
I guess a lot of people are asking you about the Swedish experience and about how you feel being Swedish and the whole context of Sweden taking its own way.
Yes.
So what do you respond to the people about being Swedish, about Sweden and its role and its example in COVID?
So first to say that I think there are many people in Sweden who are not in agreement with what the government has, the steps that the government has taken. But there are, I think, a lot of us who feel confident that the government in Sweden has actually done pretty well. But there is an ingredient in all of that many other countries, and especially I think sort of former Soviet countries, don't have. And we have an almost inborn trust in government. what comes from government is for our good. They do that because they believe it's the best thing for us. And so we usually trust the messages that come from government. Not everything, but most things. And so, for example, now, we do have high infection rates in Sweden as well. There is some kind of a second wave. But there's no forced lockdown. There's no, I think the only thing which is in law, because there is a law around infectious diseases, is that people can't go to work if they know they have COVID and so on. But other than that, but people now are staying home.
So they are just very obedient to what...
They're obedient, yes.
Was it always like that, such a high level of trust to the government?
I think so. I mean, at least in the last sort of last century, maybe. Yeah.
Oh, that's a long culture of trust to the government system, which is, I guess, playing for the good in a situation.
Yes,
like
it is. It is. Yeah.
Did anybody from your family got sick, and how did you cooperate with that? What would you advise to people whose family members are?
So I have 2 daughters, and they have families, 2 children each. And my youngest daughter, who is 34, she has had long-term COVID.
Long-term COVID,
yes.
You call it. Which lasted for how was the long?
About from March to August, basically. So not super sick. I mean, she never had to go to hospital, but she had a temperature for most of that time. She felt a sort of loss of concentration, very fatigued, and in periods she had a bad cough and difficulties breathing. But you know, when she contacted our primary health care and would go there, and they would say, you know, we see 10 of patients like you every week, and we called it long-term COVID. This was even before it was a sort of well known that there was such a thing, because there was nothing else wrong with her. You know, it just went on and on and on.
And how did you cooperate with it as a parent?
Well, I tried to encourage her. Unfortunately, she was doing her PhD at the same time. It's the same time as being a mother to 2 quite small kids, who also had to, at least from March to May or so, her oldest 10-year-old didn't go to school, but spent every day at home. So it was difficult for her. But I also realized that there's no such thing as young people don't get it. Young people are not affected. She was severely affected, and it was really difficult for her.
What is the role of UNICEF in COVID, you think, in the COVID response? What would be our role, or what is our role now?
Well, the first, I mean, so UNICEF generally, all over the world, we're very good at communication and good at sort of getting messages across to people. And we do also have, usually in most UNICEF offices, people who work on messages to change people's behavior. And we have worked previously in Ukraine on changing people's behavior around vaccinations, especially around measles and so on. So we kind of had a little knowledge, a little training on how to do that. So that we've been doing. But both the communication in general, wash your hands, keep, wear a face mask, keep the social distancing and all that. So that's been, I think those messages are still seen all over Ukraine. And then we had the thank you campaign to health workers, where we wanted to say thank you to them for the life-saving but also very dangerous work that they do. But then also we, campaigns around why people need to change their behavior and how they can, in all kinds of different media. So now that the COVAX is coming on board, the vaccine against COVID, we will be working again on communication, communicating why it's so important for people to get vaccinated, and what the risks are if they don't. But we will also import all the vaccines because UNICEF is the biggest importer or purchaser in the world of vaccines. So we will do the procurement of the vaccines that are coming into Ukraine, and that's a pretty big undertaking. We expect most people in Ukraine to be vaccinated, and most of the vaccines that are being developed are 2 doses.
A huge operation.
A huge operation. So let's say we're roughly thinking 35 to 40 million people being vaccinated times 2. And then you have to organize the cold rooms or the freezers for these vaccines to be kept. They have to be transported in freezing temperatures. It's a huge operation, and that's where UNICEF is supporting the Ministry of Health on developing these plans, actually making sure that those freezers and cold rooms or whatever are there, and then also that health staff are available to actually give these vaccines.
What do you think will be the problem with the vaccine perception in Ukraine? Or there will be no problems?
Oh no, there will be problems. I think people have a disbelief in vaccines, that it doesn't work. I mean, there's already a disbelief that COVID doesn't exist. And then on top of that, there will be a disbelief that vaccines, that this vaccine is not going to work. And so there's going to be, in certain groups, there's going to be a reluctance to be vaccinated. But we know from other vaccines, like take measles again, 95% of the population need to be vaccinated for there to be no outbreaks and no sort of wider spread of the infection. And it probably is the same with COVID. And so getting as much as 95% of the population vaccinated is going to be a gigantic task. And this is going to happen all over the world. But I think, and again, because there is that old mistrust inherited from the Soviet era in the health system, and there is a ongoing kind of vaccine hesitancy in the country, it's going to take a big effort.
Do you vaccinate against influenza?
I did.
And do you vaccinate yourself every year?
Yes.
For how many years?
So before I came to Ukraine, I lived in a country which was hotter all the time, so there wasn't a flu season. But if I knew that I would spend time in Sweden, a longer time in Sweden during winter, I would have it. So for the last 2 years, I've definitely done it. But before that, a little bit off and on. But when I lived in Sweden, I did it.
Always?
Always. I mean, for as long as I knew it was there, yes.
Speaking about doctors and nurses, we did this Doctor Thank You campaign. We have very few doctors now, a lot of nurses, and their role in Ukraine is a bit lower than it should be, we think. So what do you think about nurses in general? What is the role of nurses in Sweden or in other countries where you work, and which message would you like to send to the nurses?
So I think nurses are probably those who take the brunt of this in the healthcare system. They are there 24/7. Doctors are not there 24/7. I had a very good chat last week with a nurse from one of the bigger hospitals here in Kiev, and she said and there are always nurses there. Nurses have to deal with these patients 24 hours a day, while the doctors are mostly there during daytime. And so if something happens at night, the nurses are left to do that. So nurses are very competent. They know what to do generally. And in many cases, they have more experience than the doctors. And so she often also said that often she had to actually take patients off medications that she knew was not good for a COVID patient, like antibiotics. And so I would say nurses are essential in this, in fighting COVID. They get far too little recognition, and they are very experienced, and they work very hard, and they literally contribute with their lives at the moment.
As a head of UNICEF, what do you think about the general immunization program and its risks to go down and even collapse due to COVID? Because everybody is busy, and there is COVID and it's contagious, and COVAX vaccine is coming and everything.
I think there's a big risk. I think we need to make a renewed effort to, or continued effort, maybe is the right thing to say, to make sure that the sort of what we call the routine vaccinations, like the vaccinations that small kids get, the babies, the slightly older, and the repeat vaccinations that they need, that continues, that it doesn't stop, but that it's safe for parents to bring kids to clinics and so on, that they can be sure that when they bring their kid to be vaccinated, that they're not going to be in touch or come in contact with COVID or COVID patients somehow. And so we need to continue this sort of advertising to parents, go and vaccinate your children. But we also need to do it to health workers, because many, unfortunately I've learned, many health workers in Ukraine also are not 100% sure that vaccinating kids at this moment is the right thing to do when they're so busy with COVID. So I think we need to reach both parents but also health workers to make sure that the sort of the normal vaccines continue for kids, and even also repeat vaccines for adults who never had measles vaccinations, for example, because it would be a disaster if we have a measles outbreak on top of COVID. That would be an absolute disaster.
Yeah, that would be a true overload to the already overloaded system. As UNICEF, we are working with youth. What do you think about youth in the context of COVID? Are they the ones who are the most suffered in a psychological way, probably not in a health issue, but psychologically, or not?
I think, I mean, both children and youth suffer psychologically from this, from the pandemic. I think because there hasn't been an absolute lockdown for very long in Ukraine, maybe the consequences are slightly less here. But I think young people, what they do is they absorb the adults' worries and anxieties. And they also, you know, when you're young, you think about the future. What's it going to look like? Where am I going? What is the world going to be like? And so young people think about that, and I think it's created a lot of anxiety, mental health issues with young people that we are not addressing, because the resources, the psychological or you know, counseling resources in Ukraine are not very well known, or they're not there. Yeah.
Mm-hmm. And another question, what do you do to support yourself in the whole situation? You are in a foreign country, a boss of a big structure like UNICEF Ukraine, lockdown, COVID, risks.
Well, luckily I have 2 dogs, which forces me to go out and walk every day, which has been good. And I've started running. I started in March, actually. Running. So, you know, at 63, I can now run 5 kilometers without stopping.
Wow.
So
5 kilometers.
5 kilometers, yeah. So that's one thing that I've done, because I stopped going to the gym and I can't swim anymore like I used to. And I started keeping busy at home. So I started baking. Learning online to do certain things. I bought a lot of yarn to knit things like that. Keeping myself busy, listening to audiobooks. Yeah, and I think what I do is I disconnect from work. I'm not on my phone all the time. I'm not, going through my emails. Yes, you noticed. I know. I should take calls though, but yeah.
No, you shouldn't. I think that you are right to discipline yourself not to do it. I mean, because we doctors, unfortunately, are all the time doing it, and it's incorrect practice.
Yeah.
If you were a president of Ukraine, what would you do?
I would implement much further restrictions, and I would authorize police and other government workers to reinforce them.
If you were a Minister of Health of Ukraine, what would you do?
I would support that, what the president is saying, but I would also make sure that the messages to doctors and nurses about the correct treatment of COVID is available to them, and that they're given competency development, short courses. It can be 2 hours online on how to give oxygen, or things like that, so that they feel more confident in what they're doing, and they're actually doing the right thing also. And I think that I would also commandeer the private sector to be much more involved and offer up their services for non-commercial reasons.
If you would be a Minister of Education, what would you do?
I would retrain many of the teachers, because many of the teachers in Ukraine are quite old, nearing retirement age. They are not computer or online literate. So do intensive training, but also solicit resources so that you can focus on children who are not able to connect on, because they don't have the laptop or the iPad or whatever they need, so that they can access those things and actually continue learning.
As our boss, you always support partnerships, and our great Masha Milkova with all her efforts. And due to those partnerships, we were able to buy oxygen concentrators, for example, and distribute those to the hospitals. Why are you so much into partnerships with business, and what do you think is the role of business in COVID for the moment?
Well, I think it has, because COVID, first of all, affects everyone. And if it affects business coming here, I saw a bunch of restaurants that I've been to before that are now closed. So it does affect business. Business are involved. Business are affected whether they like it or not. And if they can engage with people and engage in the consequences of COVID, so much of goodwill will come back to them. Maybe not immediately, but one day, because they were generous, because they got involved, because they wanted to do something good. And I wish many more companies and private sector businesses in Ukraine would get involved and do the little things they can do. They can do a lot. And so I think that partnership between, not only between UNICEF and private sector, but the private-public partnership, I think this is the time to really get into that.
COVID is the time.
COVID is the time, because it affects everyone, rich, poor, anyone, and so we need to work together here.
Does it affect human rights, you think, COVID? And if yes, then how?
It affects human rights in that the consequences are not equal. So poor people, for example, those who are already sort of on the verge of falling into poverty, find it very difficult to diversify and find another way of having an income, for example. And so they fall into poverty if they lose their job, because there's nothing else, for example, or the things that they used to sell, their produce and so on, there has no buyers. And also I think, for example, we know that in like I told you about the children in institutions, but we also know people in penitentiary institutions, like prisons and things, have not had access to health care and protection in the way that they should, which they have the right to. And so there are many aspects, I think, of human rights in all of this. And then we can look only at the conflict in the East. and what's happening there, and the people along the contact line who have already from the beginning difficulties reaching healthcare and any kind of social services. And now it's even more difficult, and they are sort of doubly vulnerable. They're vulnerable because there's a conflict, and you know, there's the constant danger of being shot at, or stepping on a landmine, or whatever, or having no water for months. And then on top of that, they have COVID, where they are completely unprotected. So yeah, there are lots of human rights in this whole COVID conflict.
What do you think about everything online? Because we used to be so much offline, and now everything is online. Meetings, anything. How do you feel?
It's exhausting. It's exhausting. But what can you do? We have to work. We have to get things done. Yeah, we just have to do it. But I mean, I'm pleading even within our little UN family that can we have short meetings, because a 2 or 2.5 hour meeting online is, it's utterly exhausting. And in the end, you stop listening, stop engaging. And so, and it's not useful, then you're just wasting each other's time. So I think necessary, but be kind of vigilant and say no sometimes. I've had too much. I can't take another Zoom meeting.
How do you think COVID will affect culture? Will it blossom more because people have more time for creativity, or on the contrary, because of everything is online, the culture issues? My background, my family background is theatre. So I come from a family of theatre people, and I know, seeing theatres around, around Kiev and around Stockholm, my hometown, you know, they are slowly dying because people they're not allowed to go, they have to close down, or they can only have 8 people instead of 200, or, you know, things like that. So a lot of theaters, cinemas, music events, etc. are being cancelled, they're not happening anymore. And actors, musicians, etc., they don't have an income, so they have to find other things to do. Now, I think this is a very dangerous time for culture. It's probably a good time for sort of handicrafts and things. So sometime, you know, next year we'll see a flood of homemade stuff that's being sold everywhere. But for the sort of finer culture, I think there's a big danger. Doctors and nurses are on the edge of the burnout, basically.
Yeah.
And it's very unpopular in Ukraine to go to psychologist. And the air we did today before yours is the one with the psychologist. Do you think it's acceptable to go to psychologist? Do you think it's acceptable to look for the support from psychologists in the times of COVID, if you are a health professional, for example?
Oh, absolutely. Yeah. I mean, this is something that no one should be dealing with on their own. And the pressure on individuals is extreme at the moment. And you need some kind of support, and you need to talk to a professional and be given tools, or even medication, but tools primarily, to deal with your own stress, your own anxiety, your own, consequences of what's going on around you, the uncertainty that is around everywhere. And it's almost like a war situation, where you don't know, okay, you don't hear the shelling here, but it is everywhere, and people can drop down anywhere around you. And that stress of knowing that affects you mentally very seriously. So we need to, I think, treat it as a war situation almost, and absolutely not be ashamed to ask for help and go to a professional and talk your issues out and get some help in how do I handle my own kind of monkey brain that is always chattering and stopping me from sleeping and drinking too much or not eating or doing all kinds of things. And then get something to kind of take you down and deal with this and handle it.
Do you think COVID will affect our perception of freedom?
Probably. I mean, I thought I'd never say this, but I'm actually kind of missing things like staying in a hotel. But, it has.
Will we agree for less, or will we then fight for more of freedom?
That's interesting. I think what we will be local more. Mm-hmm. We will do things locally that affects things globally. So we will travel within our own countries more, be more curious on what's around us in the smaller sense, and be more engaged in things that are going on globally.
Since a lot of things depend on management, and especially now in the healthcare, it's crisis and it's management of crisis situation. What is your advice? What do you think are important skills to learn or to enhance for the managers now, since you yourself are as well a manager? Mm-hmm. Which skills are needed now?
I think empathy is probably number one, or as it's called sometimes, EQ, emotional intelligence, which unfortunately many managers lack, because they're not trained in EQ, they're not trained in empathy, they're trained in efficiency and trained in having things done and results, but not necessarily caring for and worrying about your staff and making sure that they're okay, because if they're okay, they can do what they need to do. But if they're not okay, they won't be able to work and produce and so on. So today, I think that's probably number one as a manager. If you can't manage that, you have to be out. Yeah.
Speaking about education, a lot in COVID, apart from crisis management, is about education of adults, because COVID is new for all of us as for doctors, and we have to educate ourselves, and nurses have to educate ourselves. What helps adults to get educated? Because basically adults are always showing off, I know everything, I'm a specialist, I am here for many years. So what would you advise for adults in being more effective in their own education?
Well, I think, first of all, they need to have a champion, someone who can show them what works and how you can do it. So someone who is pedagogically trained in, for example, doing online classes. And they need to see what they should be doing. They can't only be told what they should be doing, because they might not know how to do it. So I think the how is very, very important now. And hearing and sort of almost learning on the job, but it's almost someone holding your hands doing things. It's a very practical, I think, approach that we have to take now. Forget the theories. It has to be practical, and this is how you deal with this. This is how you reach people. This is how you change the way you do things.
We have some questions which are coming, I guess, from the person who is the health journalist, Anna Levchenko. I believe this is the health journalist. I know one is the question: what are the examples? What could be the examples, and if there exist any examples of the private partnership, private governmental partnership in private health sector in COVID? Do you have something like that in Sweden, for example, that the private health sector would cooperate with the government?
Yes. So, for example, the overflow from government hospitals could then be put into the private sector.
Even if they can't pay?
Even if they can't pay.
Who pays then?
Well, that should be the private sector in this kind of situation. There could be some agreement with government that they cover sort of essential parts of the cost eventually, but at that moment that there's no squabbling about, oh, you're going to pay this, you're going to pay that, and then before we take the patient. No. We have an agreement. When this hospital is full, the overflow goes to this private hospital. And that seems to be not working. Not that we have many private hospitals in Sweden, but it seems to be working. Yeah, and I've seen it work in other countries, like the country I was in before I came here, the Philippines. It's the same. Yeah, it works there.
Another question from the same Anna Levchenko. What in general is the role of international organizations in COVID response, and what is their task which cannot be resolved by national health systems?
So international organizations at this moment, I think, first of all, we have the global experience. We have the global experience, and we also have the global, network in getting the experience from different countries, from different settings and contexts that would be applicable to Ukraine in this case. But we also, like in our case for UNICEF, we are the biggest procurers, buyers of vaccines in the world. There is no state institution in Ukraine that can replace that. So we are in fact needed. Also, I think with expertise that we have in all kinds of fields, all of us in different fields, from labor to good governance to working with internally displaced people, all kinds of experiences and knowledge that we can assist the government with in a situation like this. So our role now is really to pick out the best of the crop of knowledge and experience from all of the world and sort of give it to Ukraine and say, here, it's for you to use, we can help you to use it.
Do you think our perception of value of life will change due to COVID, and if yes, then how?
Yes, I think it will, yeah. I think we will all realize how quickly it can be gone and how easy we can lose those we love, and especially older people, that we need to care for them. We need to hear their stories before they're gone. We need to take care of their memories. And they're not going to be there forever, and now they're going quicker than we ever thought they were going, and so we need. I think we will be a more caring society once this is over.
Will it be over ever?
I think so. I mean, we know in history that there have been other epidemics or pandemics, like the bubonic plague, for example. It came in waves several times, but it did go away. It's still around, we still have the plague, but now we know how to cure it. It will go away, but it might take some time still.
As communication and health team of UNICEF, we are doing lots of webinars and online interviews. What's your advice to us? Which topics you want us to cover?
Well, I want you to cover the primary topic. I think I want you to cover is the sort of self-discipline in this whole pandemic, that everyone has to exercise self-discipline in order for the virus not to spread. That's the first thing. And then the second thing, kill all the myths that are going around about how to treat it, that young people don't get sick, all kinds of myths that are going on. So I think those are my two primary things I want. And then maybe thirdly as, say, oxygen, oxygen, and oxygen. Yeah.
And before I will ask my last question, tell me what I didn't ask you and you wanted me to ask you. Is there anything you didn't say which was not asked?
Yes. One thing that I didn't say is that I think the government should also implement programs to support the poorest groups in Ukraine. To give them some kind of cash support at this moment would be the difference between life and death for them. It would also probably also help them to keep their nose above the surface of absolute poverty. And it's going to be very difficult for Ukraine to come back if the 6 point something million people who have fallen into poverty during COVID are not supported. So they, if they are not supported, they're not going to come back as fully productive, healthy people. And so government needs to realize that this is $1 in, but actually $10 back in terms of human investment.
So my last question will be probably a bit strange for COVID era, but still, what do you think about love?
Oh, this is all about love. Love for one another, love for yourself. If we don't have love for others and we don't have love for ourselves, then we're also not going to be careful, and we're not going to care for those who are sick. So it's all about love.
Thank you so much for coming to this interview, knowing how busy you are.
Oh, thank you.
And we will finalize at this moment.